initially identifying where our shortages might be from a clinical care point of view, and meeting with our innovation partners at the School of Biomedical Engineering to try and assess where there might be areas of collaboration. And we quickly learned that they had significant 3D printing capability and design, and there were some open source designs that they could work from. So we focused on trying to develop face shields, something that our frontline caregivers really need to provide the ultimate protection over their face in addition to masks. And they were able to design and develop some models that we looked at the labs at FIU, approved, and then they very rapidly went into production. We had to be laser focused on innovative things that we could bring to bear immediately because of the time sensitivity of this crisis. So we began more innovation on the fly. We helped identify where our critical needs were, marry those up with engineering assets and ideas that could be garnered with FIU, and together we've been working on focusing on things where the greatest need is and focusing on things that can be brought to bear quickly because of the time-sensitive nature.